Starting with a presentation from the Bureau of Pest Control Services at the Department of Health and Mental Hygiene on the neighborhood rat reduction work that is being done in our community and citywide. So the presenter is Martha Vernazza. Martha, how do you pronounce your last name?
Hi, Steve. Martha Vernazza. Hello, everyone.
Okay, Martha Vernazza. All right, sorry if I mangled your last name before.
It's fine.
So we're calling this meeting, call the meeting to order at 6:38 p.m. All right, Martha, the floor is yours.
Oh, you want me to get started right away? Okay. I will be
I do.
sharing my screen.
Very good.
Here we are. And just let me see if I'm up. Let me know if I'm up. Okay. Looks like
there you are.
Okay, so thank you for having me. The Health and Environment Committee of Community Board 12 Manhattan. My name is Martha Vernazza. I'm the community coordinator, outreach and education team lead for the health department's pest control services, particularly our neighborhood rat reduction program. I'm happy to be here and share our information with you. So the neighborhood rat reduction program includes regional case managers, inspectors in identified areas that will conduct inspections, will conduct walkthroughs, sort of like consultations, let's say, and provide assistance to property owners and tenants. So when a property is has rat activity, rat problems, it is the property owner that gets the notification, the commissioner's order to abate, informing them that there's rats out on the property, deal with it, abate, what are your abatement methods, and then we come back. Rat indexing is proactive inspections that happen. They are usually biannual, and they inspect the exterior of properties for rats and conditions that are conducive to rat activity. So garbage, harborage conditions such as overgrown vegetations, abandoned lots. So our rat indexing includes exterior inspections that are proactive. And then there are the inspections outside of these identified areas that are happening by way of 311 complaint. So when a 311 complaint comes in, we immediately go out and inspect the property, so long as there is not already a complaint open for the property. That would, in that case, the 311 complaint will duplicate into the original complaint. So in Community Board 12, we do indexing. So we do proactive, let me clear my screen, I'm sorry. We do proactive inspections. We did do proactive inspections in Community Board 12 in 2022. This is a screenshot of our rat information portal. This is a mapping tool that is accessible through our website, nyc.gov/rats. You can turn on the toggle and zoom into your community board, and you'll see that the colored areas indicate property tax lots that, thank you, property tax lots that have been inspected by the Department of Health. A green is a past inspection, a pink is a failed inspection, purple is a failed for other, such as those harborage conditions, those conditions conducive to rat activity. Gray properties are properties that were not inspected in the past 6 months, and properties with a bold or a frame around them will indicate that the health department exterminators came out to the property. Community Board 12 does also have an assigned case manager that is there to advise property owners on remediation steps, who conducts those walkthroughs, who answers those phone calls, those inquiries, those letters, who meets with the property owners so that they can reach those compliance steps. So long as the property owners, of course, reach out. So in Community Board 12, we inspected parks. So our inspectors will monitor parks for rat activity and garbage, and those harborage conditions, those conditions conducive to rat activity. Once those inspections occur, the results are then sent over to the Department of Parks and Recreation. The Department of Parks and Recreation is then expected to follow up, to create follow-up action and to start remediation. In 2022, there were 63 treatment visits by a New York City Health Department exterminator in Community Board 12. There were 32 non-treatment visits by a New York City Health Department exterminator. Non-treatment visits are usually visits where the exterminator comes out, checks for activity, checks for knockdown, and does not necessarily put down bait. In the month of January.
I'm sorry, Martha, I know what knockdown means in boxing. What does it mean here?
So knockdown is, I'll give you an example. So sometimes our exterminators will come out and bait a burrow. So the appropriate way when baiting a burrow, when placing those pellets into a burrow, you place the pellets in the burrow, you leave them for 7 days, you leave the burrow open for 7 days. And then after those 7 to 10 business days, you're expected to come back and knock down the burrow. So when speaking about knockdown, we're talking about like literally caving in that burrow. And then after that, those monitoring visits to see if the burrow has opened up again. So in this case, it means like literal, like knockdown, cave in, breaking up of the burrow. That's a great question, Simon. Thanks. I mean, Steve, thanks. So in January of 2023, we did 29 treatments. The list of parks or green spaces, I think there might even be gardens here. I'm not sure. Yes, there's the Riverside Inwood Neighborhood Garden. So these are green spaces also. So in 2023, we did 29 treatments, 29 exterminator visits in these 29 locations so far. So, and I can get these to you, Steve, these slides, so you have the list.
Yeah.
Of course. So in our neighborhood rat reduction program, we also focus a lot on community outreach, community education. I teach our Rat Academy. Our Rat Academy is a 2-hour training course for community members that teaches preventive methods, rat biology, what you as a community member can do, as a homeowner, as a tenant can do, and also you get an insight on what the health department does in terms of rat inspections, summonses, etc. So last year in October, Manhattan Borough President Mark Levine, he sponsored a Rat Academy and 31 people were in attendance. This was a virtual academy. We also do academies geared towards community gardeners. 2 of these happened last year. We do them in collaboration with the New York Restoration Projects, Green Thumb, the Department of Parks and Recreation, the Horticultural Society of New York, we partnered with last year. We are also doing rat mitigation training for businesses that offer outdoor dining. This is a part of a pilot that I'll speak on the next slide, but we've already had 3 of these trainings with the Department of Small Business Services. any community group can sponsor a Rat Academy. We do Rat Academies virtual and also in person. And our contact information will be towards the end, but ratportal@health.nyc.gov if you are interested in sponsoring an event or hosting us for an event. So we are doing community outreach alongside the Department of Small Business Services, the Department of Sanitation, the Department of Transportation for businesses that are offering outdoor dining. Currently, this is part of, as I mentioned, a pilot with Small Business Services. We are working with the Washington Heights bid. The Washington Heights bid covers 181st Street between Fort Washington and Amsterdam Avenue. The pilot focuses on restaurants with outdoor dining structures. There are teams that are going out to talk to restaurant owners about rat prevention methods. We are, again, partnering up with the Department of Sanitation. We are doing the rat mitigation training. We are distributing materials. We are doing walkthroughs and surveys with these businesses, with the appropriate staff of these businesses so that they are aware of what they can do to decrease the attraction and opportunity for a rat to want to be in or around their business that is offering outdoor dining. So here's some numbers for Community Board 12 for 2022. Last year, there were 1,226 total 311 complaints, rat-related complaints. 805 of those were primary complaints and 421 of those were duplicate complaints. So with 311, when you make a complaint about a property and there's already an open ticket, the complaint will duplicate into the original. So half of these were just, I guess, multiple calls on a specific property. So before making a 311 complaint, we are suggesting that property owners or, not property owners, rather, the people who want to express a concern, check our map, our rat information portal map for an open ticket or any recent activity on the specific property of concern using that address to ensure that your 311 complaint won't be duplicated, so that once you know there's already an open ticket, you can reach us and we can provide you with that follow-up, that information, or we can even just flag it for activity to our regional office. So those initial inspections, there were 4,481. 1,555 of those failed. 1,382 of those failed, or 31% of those failed for active rat signs, and 173 of those failed for those garbage harborage conditions, those conditions conducive to rat activity, those conditions that will attract rats. Compliance inspections, so those follow-up visits, those follow-up inspections of 1,336, 1,095 of those failed. So 78% of those property owners did not make any remediation steps after receiving the initial quota, the initial commissioner's order to abate. 52 compliances failed for garbage, and those harborage conditions. In 2022, we had 2,079 exterminator visits. Are there questions about maybe like an initial, a compliance?
Yeah. What exactly constitutes an initial inspection? I mean, the these initial inspections are, there were 4 times as many of them as there were complaints. So are those initial inspections,
Right.
are those initiated by the agency itself?
Yes, so those initial inspections, as I mentioned earlier, those initial inspections, some of them are proactive inspections because CB12 is receiving indexing, is doing those proactive inspections that we're trying to do biannually. So yes, that's why the number is doubled from the 311 complaints. So in CB12, we are doing the proactive inspections and we are doing the inspections following a 311 complaint, so long as those are not duplicates.
So are you going to places that have a history of prior complaints? How do you know which places to go to inspect?
So with our indexing, we inspect every property.
Really?
Yes. And with our 311 complaints, we visit the property that receives the complaint, the address, the tax lot.
So every property in Washington Heights and Inwood is being inspected on an annual basis?
Including city-owned properties,
Right.
parks,
Yeah.
schools, parks, schools, NYCHA properties.
Right. Everything is,
Yes,
everything is being inspected at least once a year.
at least, at the very least, although we do try to make biannual visits.
Well,
This happened in 2022. Community Board 12 is one of the newer areas that did receive indexing after 2021.
So that's based on that's a determination that's been made by the health department that it's an area that has significant rat issues.
Yes, and that's usually based on 311 complaints.
Okay. So
Oh, sorry. So those are our numbers. I can get these also to you, Steve. Were there additional questions about like an initial compliance?
Yeah, well, we have at least a couple of other questions, but this is the end of your presentation?
Yes, I want to mention that we are hiring.
Okay.
And thank you. We do have a Rat Academy coming up
Okay.
On February 9th. It's a virtual event. It happens to be sponsored by Brooklyn. If you bring your phone to the QR code on the screen, you can see the schedule of upcoming virtual academies. This is our 2-hour training on rodent prevention. My name, our email box, and our website. But yes, I will gladly take questions.
Okay, well, we should probably sponsor one of these Rat Academies ourselves. But before I get to the members, you mentioned earlier that Board 12 has a case manager assigned to advise property owners on remediation steps. How do they contact? Who is that case manager?
So the best place to contact is ratportal@health.nyc.gov. I don't know the case manager's name. I do know the supervisor. And Steve, I can definitely get that information to you via email for sure.
All right. Well, I mean, is there any reason we shouldn't circulate that person's information to local businesses and to others who may want to avail themselves of that service?
So there are multiple case managers. So when I say a case manager, I don't really mean like an individual person. We have multiple case managers, which is why I wouldn't be able to give you like the name of the specific person right now. I do know the supervisor, but I can get that information to you
okay,
for sure.
Okay, very good. All right, Tanya Bonner has a question.
Yes, thank you so much, Martha. I appreciate it. My question is about, I know you mentioned that you're working with the bid in terms of, working with businesses to help in rat mitigation. My point, I wanted to just point out that the bid only covers some of the businesses. It doesn't cover all of the businesses in the community. So, which I'm sure you know, and so you may want to, cast a wider net, in terms of reaching the businesses in the community for that. And then there are other organizations that you could, work with to that could help with that outreach if you needed it.
So that particular bid, as I mentioned, this is a fairly new, it's a pilot. So they're working,
Okay.
I think they're starting with this particular bid for the pilot. And
Okay.
depending on how that goes, it's the Department of Small Business Services who is leading the pilot. But yes, for sure. I am sure that they will work with other bids, community groups. I know, for example, our program for the purposes of Rat Academy and just getting the information out there, we definitely work with bids, community groups, community organizations, elected officials. We try to get as many people to sponsor our events so that they can reach their contacts. But yes, for the purposes of the pilot and the outdoor dining, I think they're starting with the Washington bid, and hopefully we'll definitely cast that net.
Okay, thank you.
You're welcome.
Jody Herson. Jody, you have to unmute yourself.
There I go. Sorry. I'm so happy to hear so much is being done, Martha. Let me ask you, are there penalties for non-compliance?
Okay, so remember how I mentioned that the exterminators are coming out to these properties and treating? So when the health department takes action, it is at the expense of the property owner. When these property owners are receiving those compliances or failing those compliance visits, the property owners are being summoned to the Office of Administrative Tribunal hearings, and they are receiving fines from $300 to $2,000 for repeat offenders.
So if you walk into a building and you see that the sanitation area is just a disaster, and even though you're baiting, you're exterminating, they're not really taking care of, because I mean, it appears to me that so much of this rat problem is following the garbage and
Sanitation
and if
is
we can
pest
get rid of
control.
the garbage
Yeah.
and actually have the garbage contained, it seems like we'd be a lot more successful. And if we can put some kind of financial responsibility, it sounds like you are, to
Yes,
the maintenance of the area where the garbage is going.
which is why we also fail for other, which are those garbage harborage conditions. So not just a presence of rats or rat activity, but also those conditions conducive can cause a fail, can cause a compliance inspection that lead to a summons, to a fine. And again, the health department exterminators do come out, and this is at the expense of the property owner. They will receive, I think, like a bill on their taxes. They do get charged for the service. It's not a free service.
Okay.
For private property owners.
Okay. Thank you.
You're welcome. Great question.
Julio Batista.
I was just going to add to what Martha just also indicated, that I mean, we work with a number of buildings which are HDFCs, and in fact they have.
I'm sorry. Who is we?
The HDFC Council.
Oh, all right. So you're talking in that capacity right now.
Correct. Yeah. So they do have Department of Health or the city does inspect and does force buildings also to buy rat-proof containers. So a number of buildings have had to upgrade to ensure that those containers are rat-proof. Otherwise, they will get fined as well. That's it, Steve.
Thank you.
Well, the city is also, the Department of Sanitation is also instituting a new policy as to when you can put out your garbage. It should be at a later hour, so that presumably it'll be less of an opportunity for the rats to get into them.
Yeah, definitely visit the Department of Sanitation website. on those changes and how they impact, but it's or how it may impact your put out time for your garbage. But definitely it is an effort to reduce the opportunity for rats to feed and scurry along your garbage. It decreases, I guess, that time for that buffet to be available.
I say, Martha, it was very interesting that you posted that information about work that you're doing in various parks. I work for the Parks Department, and so I'm somewhat familiar with the work that you're doing in our parks. But I think we've been moving away from using pellets, which you had mentioned earlier. But we've been using either dry ice or carbon monoxide to try to kill the rats. On the assumption, I believe that that those methods are maybe less harmful to any humans who might come into, who would otherwise, they could come into contact with pellets, but wouldn't necessarily come into
Secondary.
with these other items.
Agreed. Especially in our green spaces or any spaces that are away from any structures, it is being used, that dry ice, that carbon monoxide, dioxide. There's also that Burrow RX machine. So they are using the dry ice.
Right.
In
We
a lot of
we are using the XRF machine too. Yeah.
in those areas, in those large green spaces that where it is safe to be used, away from any structures, away from anything that can harm the public. And it does decrease that secondary poisoning that you mentioned, Steve.
Right. Tanya.
Yes, thank you, Steve. And I just so you know, there's someone in our attendees named Laura who has her hand up. But I had one more question. In terms of the pilot, how long will this pilot last, and when do you anticipate it would be expanded? And then another question. Now, you may have touched on this, and please, I apologize if you have.
Okay.
In terms of working with the residential, are there any special initiatives to specifically work with them? Because some of this is just lack of sanitation in some of the buildings as well, not just the businesses.
So to answer your question about the pilot, it is very, very, very we just started, I think, this month, collaborating with small business services. I can get more information for you for the group. I can definitely get that to you, but it is a very early pilot. I'm not sure how long. I think it's supposed to go through the spring. And then once I don't know farther than that. I'm going to be completely transparent. I don't know anything further than that, but I can get more information. But also I do know that is very new, like this month. And to answer your second question, by residential, you mean tenants, not owners?
No, I mean owners.
Okay, property owners. So as far as the residential goes, we do have our rat academies, which hope to get everybody educated. We welcome, like I said, to visit our schedule, attend an academy, sponsor, of course, an academy. We are trying to go lean more towards in-person events. But we do virtual events. We have a lot of virtuals on our calendar, and we are glad to come out and share our information and make it specific to our audience. Whether it's tenants, whether it's property owners, whether it's property managers, right? Those superintendents of buildings, things of that sort. I think it was those two questions, right, Tanya?
Yes, thank you.
Okay, you're welcome.
All right, we've been joined by another committee member, Jacob Banis. Laura Corona, who I believe also works for the Parks Department. You have something, you have a question for our speaker?
Yes, thank you. I do work for the Parks Department. Yeah, so I'm a board member of Ring. We're a Green Thumb Garden. We had an inspection last year and we've been waiting for treatment, I believe, for over a year now. And the inspector tried to do another inspection this year, but I'm not really sure why like there would be a second inspection. Like what's the logic, the reasoning behind it if we haven't had a treatment? And also, do you know what the issue is with us waiting such a long time? Is this I guess the normal time frame for treatments in the area right now?
So the treatment is expected to, it depends on the area, it depends on the park, it depends on the budget for if Parks is working with these, excuse me, Green Thumb, yes, Parks is working with these particular parks. You can send me the information about the individual park, but I think it is expected for the Parks Department to treat the park. Otherwise, the Health Department steps in. And then the reason for the second visit, it's because it may be part of that indexing, those proactive inspections that are occurring or did occur and will continue to occur from 2022 moving forward.
Okay, yeah. I mean,
What was the name of the park?
So we're a garden. We're a Green Thumb Garden. It's on your list, Riverside Inwood Neighborhood Garden.
Okay.
And I understand the indexing. But I mean, if we haven't had an inspection, like the assumption would be that the rats are still there. You know, they're not going to go anywhere. So I'm just trying to kind of understand like why those procedures are there. If we haven't had a treatment there, why would there be another inspection?
I'm not sure. Sometimes, like I said, it's expected for Green Thumb or for the Parks Department to treat, which is why we would come out to the second time to see if they have treated, or we are just coming out the second time because it is part of the indexing.
Okay.
But for sure, Green Thumb Riverside Inwood.
Riverside Inwood Neighborhood Garden.
Neighborhood Garden. And your name?
Laura Corona.
And you're with the Parks Department?
I am, but I am in my capacity as a garden board member.
Okay, but we can reach you at your DPR email.
You can send it to my personal email.
Okay, you can email us ratportal@health.nyc.gov, and then we'll get all the specifics and we can follow up.
Okay, great.
Thank you, Laura.
Thank you.
All right. Any other questions or comments from the committee members? All right, very good. All right, well, thank you, Martha.
You're very welcome. I did share our website and the email on the chat box.
Right.
And I thank you all for having me and your questions.
All right, and you'll be sending me the presentation, right?
Correct.
Okay. All right, thank you very much.
Thank you.
Okay. All right, next on the agenda is a presentation about NYC smoke-free by Stephanie Altman, I believe. There she is, Stephanie Mercado Altman. Go ahead, Stephanie.
Perfect. Hi, everybody. Yes, as I am Stephanie Mercado Altman. I am the Manhattan Community Engagement Manager with New York City Smoke-Free Public Health Solutions. And in a similar fashion, I'm just going to present my screen. So we have a presentation to go through. Just bear with me as perfect. Okay. So here we are. Let me just put this in presentation mode. Perfect. So I just want to thank everyone for having me and just having us speak at New York City Smoke Free on this topic that is about the tobacco epidemic that is hitting our city at present. So just an overview of PHS, or Public Health Solutions, which is our home organization. So we are the biggest public health not-for-profit here in the city. And our mission is really to support vulnerable New York City families in achieving their optimal health and helping them reach pathways to reach their potential. And our work or framework of the delivery of care and the services that we provide are based and function on health equity principles. So we believe that everyone should have access to high quality care and services too. So as for the mission for New York City Smoke Free, we are a program, as mentioned, of the larger Public Health Solutions organization. Our mission is really to help increase tobacco-free norms throughout New York City, as we believe every resident has the right to breathe clean, smoke-free air where they live, work, and play. So this counts for our children, our older folks, people working. And through our work, we do partner with community members, community boards like CB12, legislators, and also health advocates to support the local efforts really to end the devastating tobacco epidemic that we see here in the city. And to date, since we've been in existence, we've helped 54,000 families throughout New York City to go smoke-free, and about 16,000 units that we've helped as well go smoke-free, which I'll go into a little bit later. And as well,
I'm sorry, Stephanie.
Yeah,
In what period of time have you done all that? Have you done that work?
we've been in operation for about 15 years now. And we are a grant-funded program by the Bureau of Tobacco Control from New York City, from the New York State, excuse me. So yeah,
Okay.
we've been in 10 plus years. I just began last year, so I'm still very new to the work, but our work is pretty deep in the communities. Yeah, and just to mention too that our services, as we believe health equity is a very important principle, that our services are free for everybody. So we're really here to help leverage on community partnership and all of that. So hope at the end of the presentation, we can discuss what ways we could work together.
Do me a favor, go back to the
Ooh,
previous.
absolutely.
You've helped 54,000 families and 16,000 plus units go smoke free.
Yes.
I'm not sure what that means.
Yeah.
Because can you legally require, can property owners legally require that people cannot smoke in their own apartments?
Great question. So actually the policies that, the answer to your question is no. The policies that we do help residential buildings in all forms, condominiums, or co-ops rather, and market rate. We work with supportive housing organizations as well, is that these smoke-free policies are voluntary. And these are smoke-free housing policies, which would ban the activity of smoking in individual apartment units. So
In individual apartments?
correct. Yeah, there is a New York, I'm sorry, what was that?
But I thought you cannot do that. You cannot ban it.
Correct. Yes, there is a New York City law that is, if a building has more than 3 or more dwelling units in the building, they do have to have a smoke-free policy for the common areas in that building. Correct.
But that doesn't cover the inside your own apartment.
Exactly. Yeah, that's the differentiation between like the work that we do for smoke-free housing versus the law that is New York City law.
Right.
For smoke-free. Yeah. So sorry about that confusion there.
Okay.
But yeah, and I'll go a little bit into the voluntary policies that we do help with. So yeah, but thank you for clarifying that. I'm sure other folks had questions. Yeah, and really just to draw it back to CB12 and making the smoke-free a reality for the community that is in Washington Heights and Inwood. Just to give context, smoking prevalence in New York City has actually gone down and has halved in the last 10 years, which was at 22% 10 years ago versus 11% now. So it's a huge accomplishment, I think, through a lot of community efforts, public health campaigns, but it still is an issue for a lot of communities that are seeing a continued behavior with smoking. And for CB12 specifically, this is data extracted from the community health profile of 2018. This was the latest data that I could extract as public domain data. So I can do my best to look into more updated data. But as for right now, Washington Heights to date is 13% of the smoking prevalence, which is pretty comparable across the board with Manhattan and New York City at large. But I am sure that as we've, walked through the streets of CB12 in the district, and also, other places in the city, we have seen the proliferation of smoke shops having been established. And, if we have kids or, children that do go to school, the marketing and the exposure that these youth are exposed to is also, one, a community health concern, but also the involuntary smoke exposure that we do get from cigarettes, e-cigarettes, and other combustible cannabis products, which, marijuana has been legalized in the last couple of years. And I'll go a little bit into later also about our reality check program. So that's why I brought up the youth as well, which is another point that I will touch base with. But to also to draw points of the comorbidity between smoking and chronic disease, we see, again, this is extracted from the New York City community health profile for CB12, that there is always a correlation between chronic disease and smoking. And comparably, there are higher statistics for, comorbidities in Washington Heights versus Manhattan, New York City. And I think this just brings to home, I think numbers do tell a story, and I think this just brings to home even the imperative work that, we could perhaps embark on together to fight this tobacco epidemic and help people mitigate some of the complications with a comorbid status. And, to go along with that, chronic or not, if we have diseases, I think secondhand smoke exposure is very dangerous. And, with more people spending time at home or outside in the community, if we are inhaling secondhand smoke, it is very bad for our health. And I'm sure all of you are privy to this information, but I think it always sets the precedence for why we do the work that we do. And so secondhand smoke does contain about 7,000 chemicals that are highly toxic to our system, which 70 of which are carcinogenic. And the U.S. Environmental Protection Agency has actually classified the ingredients in secondhand smoke, such as asbestos, arsenic, just to name a few, as Class A toxins, which is actually the highest classification level for any sort of chemical that is invasive to our health. And similarly, if we bring it back to chronic diseases such as asthma, any sort of respiratory infections, especially with COVID, do have adverse effects on the heart, lungs, and other, organs that we have. And we are especially concerned about, again, our youngest children that may have chronic health conditions and older adults, COPD, things of that nature. So, and to frame it all within the last couple of years of, how our world has changed with COVID, I think it's even more imperative that, we continue to push smoke-free efforts and, try to partner with communities as well. So I'm going to switch gears a little bit to more of the smoke-free housing, and the why we want to, pass these policies if helpful for buildings. And again, this is just information to draw the picture of what smoke-free or smoking dwelling would look like. So, we all live, hopefully, or maybe we do live in apartment buildings here in the city. And figuratively, if you can smell what your neighbor is cooking down the hall from you, you can also smell secondhand smoke, cannabis smoke, whatever it may be. And this is because tests have actually shown that 65% of air is shared between units. So these, smell does travel, smoke does travel through gaps in the walls, any windows that may be open under doors, mechanical chases, and through gaps in the ceiling. So, we understand that, we are sharing the air that we are breathing with our neighbors as well. So I think that does set a context for the secondhand smoke exposure, which is not great. And also the environmental hazard of having smoke or having smoking neighbors in the building that we may live in. So this is from the Bureau of Fire Investigation from their annual report of 2020. And actually smoking is the second leading cause of accidental fires in the city. And also accidental smoke fires are the fourth leading cause for injury. So just to draw the picture literally here for you. So this is a graph showing the summary of fire fatalities by cause, at which if you see in the middle there, smoking is the second leading bar, showing the second leading cause for fire fatalities by cause. And this graph here is showing the summary of fire fatalities per category. So smoking fires are the fourth leading cause here for this category. So just to bring those points home a little bit to our safety, even in the four walls of the apartments that we live in. And also, I think, if there is a monetary incentive for people, that's always a good thing to drive home as well. So the smoke-free policies, that it has been shown in the research that it does yield higher property values for landlords. So this being like a recent study found that costs and properties allow smoking everywhere were actually nearly double that of smoking related costs incurred at smoke-free properties. And compared to smoke-free units, cleaning and refurbishing costs can actually be up to 3,000 more dollars in units with heavy smoking than not. And every year, the maintenance and refurbishing expenses are not the only costs associated with allowing smoking in the building, but actually fires caused by cigarette smoking have actually resulted in $300 million in property lost each year. So, and lastly, New York State will also save more than $57 million if in annual healthcare costs, renovation costs, building costs, if smoke-free housing was actually a widely adopted initiative. So just some, numbers there for financial framework to see like how actually a smoke-free housing property could help landlords in saving long-term. So with all that data to draw a picture, shifting to how we actually do the work that we do and what it is. So we in terms of a smoke-free housing policy at a high level, we do hope that it would protect and promote the health for all residents, whether one is a smoker or not. And do want to say that we have resources for people for our cessation services and things of that nature. So we are here to help from end to end and continuing on from when the policy that we help you adopt or the building adopt is implemented. And also a smoke-free policy would help for a cleaner, healthier environment in a building to live in, as well as landlords may even have perks, to point to the last slide, on insurance savings and just have higher property value and attraction for potential or, even current tenants to live in their building. So how does this all look when we are like helping buildings go smoke-free? So we do provide the technical resources to help buildings go smoke-free in terms of, from end to end. So we help survey I guess I'll speak to the policy in action. We survey and help see what the interest in the smoke-free policy would be. And then educate, what I'm doing here is speaking with you all about what our services are, what they entail. And then finally, the part about developing and finalizing the policy for the building and for then the organizational body, whether it be the board or the property management company, to decide on that smoke-free policy. And I do want to highlight that these policies are voluntary. So this is something that hopefully some buildings would hop onto, but they are a voluntary process if a building wanted to partner with us on it. And we do holistically try to hear all of the views from residents, from landlords, to try to make a process that is, amendable to all. So, yeah. And in a similar fashion, we also help businesses or any sort of community institution go smoke-free in terms of designating an outside zone outside of their business or school, in passing a voluntary tobacco-free outdoor policy. So our policy process is very similar. It just would matter for a public-facing institution. So whether it be a storefront, school, whatever it may be. So I want to say that we are here to help with those spaces as well. And here's a little bit about our reality check program. So in tangent with the community engagement side, which is more the voluntary policy side that I run, I do have a counterpart here in the city that does head up our reality check program. And if you have any youth that are looking to join, we are always here for recruiting. And this program is for any New York City public student or public school student who is from 13 to 18. And it's a really great program as they learn, leadership skills. They do get to travel to Albany to speak with legislative officials. We are doing that actually on Tuesday to pitch for sustained funding for our program. And it also gives them, it cultivates skills of project management and just speaking. So it's really a great opportunity for them to dive into something that may not otherwise be offered regularly in their school. And I would love to connect with you all later if this is something that is helpful or even of interest. But yeah, it's a great, it's definitely a student-led adult supported program. So we do rely on the youth to bring that unique and refreshing voice to community spaces that we speak to, or even elected officials. And everyone, I think, does enjoy having a different perspective given. So, and I think, and I'll just wrap it up here in terms of just proposing concrete ways that, we maybe could work with CB12 and, just start on a partnership. So if there is an opportunity to contribute to your newsletter on our youth engagement and smoke-free housing work, would love to, work with you so that we can be of resource to those community members who live in CB12's catchment area. Additionally, there is actually a YouTube video called Black Lives, Black Lungs. I'm sorry for the typo there with the double slashes, but we are, and apologies for the CB11, but I meant CB12, was a typo there. We could host a community discussion screening on that movie, which looks at traditionally the targeting of the Black community with menthol cigarettes and menthol products. It's a really, really insightful film, but do encourage you to check it out if that is of interest to you on your own. And finally, if there are property managers, I know that development is always happening in the city, or even existing property managers. If there is any sort of introductions that could be facilitated, I would be most grateful for that. And also in the same fashion for the high schools that are in CB12 to see, if there are opportunities to work with high schools there. Yeah, and I would say those are my 4 points that I wanted to just drive home and just have, ways for meaningful work and impact in CB12. And this is my contact information. I am my counterpart Io can be here tonight, but he is our youth engagement manager for Manhattan for New York City Smoke Free. And that's my spiel. So thank you.
Okay, well, thank you, Stephanie.
Yeah, thanks a lot.
I would think that we certainly should have at least one high school that would be interested in working with you, which is the Community Health Academy of the Heights.
Oh, that's great. Okay.
That would this would seem to be right up their alley.
Absolutely.
We should be able to get you their contact information if you're not already working with them. I'm particularly curious in knowing how your organization is dealing with
right
with the cannabis program these days, and with the fact that there may be apart from all the smoke shops that are around, there will now be official dispensaries that are selling selling the cannabis. And then presumably people will be smoking it in public. Has your organization taken a position on the cannabis program?
So we actually are, because of the state of our funding and the nature of our funding, we actually don't have, we don't do the enforcement of checking about the cannabis or the illegal tobacco retailers that don't have a license. But if anything, we can provide education on that. And that's something, we have seen our youth get stricken with, especially, and also in tangent, like having more complaints to our program, people of complaining of cannabis smoke in their building. So the question is like, the answer to your question is unfortunately we don't, but we definitely have a partnership with the DOH that does that enforcement work. But we have helped buildings like, for example, include cannabis within their smoke-free policy, smoke-free housing policy rather, to eliminate that as a substance to use. Any sort of combustible, which is something that you can just smoke, cannabis product. Does that answer your question?
Well, I guess so, but
I guess so. Okay.
but I can only imagine though that with the increased sales of cannabis and its
Yeah.
legalization, that you may end up that you probably will be getting a lot more complaints.
Yeah, we certainly are trying to shift and pivot to recognize that it's been tricky. Yeah.
All right, Tanya.
Yes. Hi, how you doing?
Hi, Tanya, how you doing?
Stephanie. Yeah, I just wanted to echo, one of the things I want to do is echo what Steve said about the cannabis, because, at least where I'm at, I walk down the block and I'm getting a contact high because everybody's smoking right there on the street. And I had a neighbor who was just smoking. I used to have to burn incense, opening windows, so I didn't get high. You know what I mean? So I I think you got your work cut out for you in terms of addressing that, because people are just lighting it up right there on the street and in the parks and everywhere. I see it, so it's a problem that I hope, there could be a solution to that. Just so I was going to also mention, like, this board just voted on a cannabis task force. So maybe perhaps, that's an area where you can collaborate with them on this particular, and Mary, who's on this, is part of that task force. So yeah, you and Mary get together.
Yeah, I would love to talk further. Yeah.
Yeah. But then
great.
my question is
Absolutely.
about how can you enforce, like, how difficult will it be for landlords to enforce a policy on smoke free? Because I think sometimes they run into, tenants will push back and say, look, I pay my rent, I should be able to do what I want to do in my apartment or in wherever. And so how can they overcome those obstacles? Do you think this can be an obstacle to getting these programs, to expanding that? I'm just curious, and how you plan to overcome that. Yeah,
and it's certainly not a new. Thank you for the question, and I really appreciate that. It's definitely the enforcement issue is definitely something that is tricky, because historically smoke-free housing policies have resulted ultimately in someone getting evicted, and we just know the housing instability and the crisis that has paralyzed our city in a lot of ways, and we don't ever, I think, just out of a health justice for you, we don't want to evict people. So we have worked with I have worked with buildings to either have a gradient monetary fine scale. So like the first warning would be a spoken warning, and then from there a written warning, and then some sort of monetary, probably a $50 or $100, I think, something that is fair for the tenant to pay for. But also there also have been, on the flip side, I think, more restorative justice approaches, which I'm more of an advocate of, just for humanitarian reasons, that someone, if after 3 or 4 spoken and written warnings that it's that policy is still being violated, that maybe community service hours are completed or something like that. It's something that we would work with the building to come to a meaningful and purposeful conclusion with. But
sounds good. Yeah, I appreciate your work.
Yeah, thank you. Yeah, we have to pivot and recognize where people are, and it's just, eviction is not a solution anymore. So
do landlords legally have the authority to fine people for smoking in their apartments?
They could if it's in the policy, then that definitely gives them that legal right. Correct.
I think it would have to be written into the original lease or something. I don't think they can just issue a dictate and suddenly start fining their tenants.
No, and right. I think, and this is where it gets a little tricky. You're completely right there, Stephen. The lease would have to be renewed, and then those new rules have to be instituted. So not just out of nowhere, out of, blindsight that there would be finding happening. Yeah. That's a great point. Thank you.
Cheryl Miller and the attendees.
Yeah, what's that? Hey, Cheryl?
Yeah, hi, thanks, Steve.
Yeah.
Yeah, so hi, Stephanie.
Hey, Cheryl.
So, yeah, I want to echo something that Tanya had said. Because the building that I live in, I've been living here like almost 16 years. I'm a former cigarette smoker. Okay, I was a cigarette smoker for many, many years. And as a result, I have issues with my lungs. I have emphysema and chronic obstructive pulmonary disease and asthma. And I'm on a bunch of medications. And my lungs have been smoke-free for like over 20 years now. So, and I'm 68 years old. And I know the effects of secondhand smoke. And I had asked my landlord a while back ago about, people smoking. And I was told, well, they pay their rent. They could do what they want to do in their apartment. I understand that, but it is a serious health issue. I have a neighbor who's constantly smoking weed. And you're right, it does. It comes in under the door. In my hallway, there is no ventilation whatsoever. So a lot of times I leave my house. Sometimes I go out 9 o'clock in the morning, boom, I get hit with the smell. As soon as I walk out my door, if I come home sometimes in the afternoon, boom, I get hit with it. And a lot of times I go in my bathroom and I don't know how, because my neighbor's bathroom is nowhere near my bathroom. And somehow I smell it in my bathroom. And, I have a serious issue with that. And I was told by even the landlord's attorney, they said, we cannot evict somebody because they have legalized marijuana. I'm like, I'm well aware of that. But at the same time, you can't just say, well, too bad, because it's legalized. So we're sorry that you have health issues, but too bad you got to suck it up and deal with it. So I hope that, that you can do something with the landlords. And also, I know that, a lot of the new buildings now that they put up in New York, a lot of them are smoke-free buildings, a lot of the new buildings now. And one more thing, that up here, we have there's a high rate of childhood asthma up in this area as well, Washington Heights, Inwood. And, breathing in secondhand marijuana smoke is just as bad as breathing in secondhand cigarette smoke. There's really no difference. So,
Well, actually, Stephanie, what is, do you agree with that last statement? Is there no difference between regular tobacco smoke and
that's what I had read.
secondhand smoke and cannabis secondhand smoke?
Yeah. So it has been shown in the research. It wasn't I know in my presentation, but the ingredients and anything that you burn, hypothetically, that you are inhaling is just not good for you. But very similar ingredients that have been found to be in tobacco products have also been traced in cannabis products, especially when you burn it. That's what makes it that's what just makes it toxic. I can provide you materials on that if that's something that you're interested in. But Cheryl, thank you for sharing your story. I do appreciate it. And you can feel free to email or contact me, and we could talk further about, potentially me reaching out to your landlord and seeing if, we could find a middle ground there if you're comfortable.
Okay, yeah, I just took a snapshot of your information, so I have it.
Okay,
Thank
perfect.
you, Stephanie. Thank you.
Stephanie, Cheryl and I are in the same building.
Yes,
Oh,
we
so
are.
you're neighbors. Okay, so we can
Yes.
talk.
We
definitely
suffer
talk.
together.
Yeah.
I would love that. Yeah, I would love that. See what resolution hopefully we can come
All
to.
right. All right, let's make it clear.
Yes.
Tanya is not the neighbor that Cheryl is complaining about.
No, I figured.
No,
just-
no, she's not.
Okay, I just want to make that clear for the
Of
record.
course.
Thanks,
All right.
Steve.
All right.
Thank you.
All right, anyone else with a question? You know, something we also had, I think,
Mhm.
I don't know if it was a reality check program, but
Mhm.
reality check is the youth program.
Yeah, I can actually go back here.
So there was a youth program working out of the YMYWHA of Washington Heights and Inwood on Nagle Avenue a few
Oh.
years ago. And the kids went around to different stores. I think they were checking on whether or not the stores were selling cigarettes to minors, or they were doing some kind of a survey, I think, along those lines. That goes back a number of years.
Oh, that's great. I didn't know that happened. I don't, were they doing like a project overall or just doing
Yes,
that
yeah.
survey? They
I
were.
think so,
Yeah.
I don't know, you might want to get back in touch with the
Yeah. Do you know where
why.
the why? Okay. Okay. I will definitely look into that.
Yeah.
Thank you. All right. I don't know if anyone else has any other questions or concerns.
Well, we have somebody from the public. Hold on a moment.
Yeah, absolutely.
Lynn,
Hi,
is it?
I
is
live in Inwood. I really want to echo quite strongly because I think it's the elephant in the room that's not being talked about here. What Steve and Tanya and Cheryl have been saying. If you walk down the streets in Washington Heights and Inwood, what you see, older people, young people, what they're smoking is Mary Jane. They're not smoking cigarettes. The real problem, at least in our communities, it might be different in other parts of the city, although from what you smell, I think it's similar. It's marijuana. So what I heard in this presentation, really good, but the focus seems to be on cigarette smoking. And the crisis our community is facing now is dope. It's you walk down through Fort Tryon Park along Broadway, you'll see high school kids at 3 o'clock sitting on the benches smoking dope. You go up the steps in the summertime towards Fort Tryon Park, you know, that graded hill, the kids would hang out there and smoke dope. So what I want to convey is for you to take back to upper management, the real crisis is talking about the dangers of smoking marijuana. And it's one thing if you're an adult and you're making that decision, but if you're a kid, can you provide them with the tools so they can make the informed decision of, oh, okay, well, maybe this is harmful, although we know kids and rational decision-making don't always go hand in hand. So I just really wanted to stress that point. I think this is so much larger than the work that you're doing. If we encourage landlords, which I agree we totally should do, that we should have smoke-free environments, then what that does is then people that want to smoke dope, they're coming out, they're doing it in the streets, they're doing it in our parks where our kids are, where our babies are, where our elderly are. And I think that this is like I said, a much broader issue. And I'm really glad to hear that there's a cannabis task force that's been formed, and hopefully that you all can start to grapple with these things. This is not something that's going to be solved just in Inwood and Wah Heights. It's a citywide issue. So thank you very much, and appreciate the work that everybody's doing on this.
All right, thank you for your comments.
Thanks, Lynn.
We have Mary Anderson, who is the chair of the Community Board Committee on the Aging and a member of the Cannabis Task Force that we just mentioned.
Hi.
How I got there, I don't know, but I said, you know, it'll open my mind up to perhaps figuring out what needs to be done in terms of the cannabis, because I, like Cheryl, I have bad asthma, and going down the streets of Washington Heights, where I live, I have great issues with the smoking of the marijuana in the streets. First of all, it makes me sick to my stomach. Secondly, it causes me to have an asthma attack. I have made many trips to the emergency room because of the smoking, and in the parks as well. And again, as Stephanie, or as somebody had pointed out, you know, the kids smoking it, the young people. in the parks. You know, I can't think, like in the summertime, it was very difficult to sit in the park because the kids would be coming there after school and sit in a group and smoke. And you could smell it all around the park. The task force is brand new, newly formed, and the goal at the beginning is going to be looking at regulating the sales so that at least, you know, that's in place. As far as enforcement goes, don't know if we're going to be able to get into that, at least out right away. So, you know, we'll keep you posted. We just don't know, you know, exactly where this is going to go or how quickly.
Yeah,
So-
absolutely. Yeah, do keep me posted. I'd love to connect.
Okay.
I'll work with
I am not the chair of that task force, but
Okay.
I will give him your information.
Wonderful. Yeah, and we can
Okay.
go from there. Thanks, Mary. Yeah.
Okay.
All right.
Well, I tell you, it would be good if the task force would take into account the concerns of this group and maybe
Mhm.
rely upon Stephanie as a resource.
Sure.
Because
Right.
the issue here should not just be the sale of cannabis. It should look at the entire picture.
Right, exactly. And that's what I'm hoping to, and why I, you know, agreed to, you know, stay on this task force,
Mhm.
because I'm looking at the broader
Very good.
picture, you know, at least from my end, and, you know, for the seniors
Yes.
Right.
All
and the
right.
youth.
All right. Well, I'm glad you're on that task force.
Okay.
Thank you.
All right. Anyone else? All right. Well, thank you, Stephanie.
Perfect. Thank you, Steve. Thanks, all.
And I'll probably be in touch with you.
Perfect.
What is the offline?
Offline. Yes, that is the term that we use in this
Yeah.
technical age.
Yeah. So I definitely want to see if I can link you with the Committee Health Academy of the Heights. Julio, would you know who she should contact there?
That would be great.
Yeah, if you, I didn't grab your email, but if
Oh,
you do, let
okay.
me, no, I changed my mind. I did. I took a picture of it
Oh, okay. All right.
because I was thinking also of our youth hub and something else, but also, as Steve mentioned, I could get you the information for the Community League of the Heights,
Mhm.
Academy of the Heights.
Great.
But there's also a school at George Washington High School that
Oh,
centers
that's right.
also
Yes.
on health careers,
Yes.
Oh, perfect. Okay.
which I've also put you in touch with.
That would be
And
great.
perhaps partner with them as well.
Awesome. Thank you, Julio. I appreciate that.
Yeah. Julio is the
Great.
Government and Community Affairs Liaison for New York Presbyterian Hospital.
Awesome.
So he's somebody you should definitely be in touch with.
Yeah. Awesome.
I'll shoot you an email.
Okay. I would love to connect further. Yeah, that
Oh,
would be great.
yeah.
Thank
All right.
you.
All right.
Thanks,
Good.
all.
All right.
Yeah.
Well, that should make your presentation tonight worthwhile.
Absolutely.
Just having the connection with Julio. Okay.
Everybody in
Yeah.
total.
Okay. You're right.
Thanks,
Okay.
all. Yeah,
All right. Oh, well, very good. Thank you so much for coming.
of course. Thank you for having me. Look forward to working together.
All right. Thank you.
Thanks, Steve.
All right. We're now going to shift to the updates on COVID-19 and other health issues. The current report from the Department of Health on COVID-19 as of today shows that the 4 zip codes in Washington Heights Inwood have positivity rates which are lower than where they were a month ago when we last met, and in fact are lower than the citywide average for last week was 9.9%. All 4 of our zip codes were below the citywide average, but they were all around 8 to 9%. So you know, I'm sure they're higher than they should be otherwise. And there were 144 people who were stricken with COVID last week, which is 144 more people than should have been stricken with COVID. We now have since the beginning of the pandemic, close to 66,000 cases of COVID in our district. 1,560 new cases since we met a month ago. 995 people have died in Washington Heights Inwood because of COVID 8 more since we last met in January. And we're still struggling in many of our zip codes to increase the vaccination rate. And 3 of our 4 zip codes at least are above the 80% rank for 80% mark for having at least people with at least 1 dose of the vaccine. Zip code 34 is still just a tad below 80%. The 3 others are above 80%. So having said that, I think it's clear that COVID is still with us. Pauline Ferranti from the Health Department has broken her consecutive record of attending our committee meetings. She couldn't attend tonight because of a personal matter. She did send me a report. She says that as I request.
That's because, Steve, I wore her out this morning.
Oh, it's something. It's your fault. Okay.
Must be.
I knew I should have given you her contact information. So as I requested, she inquired about the status of the work to be done at the District Health Center at 600 West 168th Street. She says that the Department of Design and Construction has not confirmed a timeline yet. It appears that they are still in the pre-planning stages, and they anticipate starting the design phase later this calendar year, which means that the construction is probably going to be at least another year off. With regards to tick surveillance, which is a question that a member of the public has raised a few times, she says that our agency has a robust surveillance system. She provides a link to an advisory issued in the summer of 2022 on preventing tick-borne diseases as the summer approaches, in which data on cases of Lyme and what types of ticks we are finding in New York City are reported. She also says that the city has announced the end of the Mpox outbreak. They have declared the end to Mpox after the nation-leading response in New York City. So she apologizes if she left out any other updates. Well, she left out information about COVID. And please send me an email with all of the questions that may require my attention. I don't believe Sandra Harris is with us. So Julio, you're up.
Thank you, Steve. I'm also going to be brief. Just to follow up on the COVID numbers and what was reported from to the committee last month. Just want to share that we're also trending and very slowly in that same direction that you mentioned, with one exception. So hospital-wide, meaning all our different campuses throughout the city, we had a total of 373 cases. That's down down from 432, which was reported last month, and we have 43 patients in the ICU. As it pertains to Community Board 12, at the Island Hospital, we have 16 versus 20 cases last month, 1 versus 2 in the ICU last month. For the Columbia Milstein, we had 74 cases versus 78. So we have a drop of 4. And in the ICU, that number has not changed, still remains at 10. The only slight difference and there's a slight uptick has really been at the Morgan Stanley Children's Hospital. So these are anyone under 18. So we had 11 cases a month ago. Now we have 14 cases, and ICU census also went up from 4 cases to 7 cases in the ICU. So it's a little mixed. Adult side, we're going down, trending in the right direction. Unfortunately, in children's, it's gone up slightly. just also want to, do you have any question on that, Steve?
Yeah, I'm a little unclear. When you say these numbers, do they represent a 1-day figure that
This is,
that there are 373 cases in the NYP system as of today?
as of this morning.
As of this morning? Okay.
Right.
So
Yeah.
these are 1-day figures. So there are at the Allen, there are 16 today, one in the ICU today. At Millsy, 74 today, 10 in the ICU. At Choney, the Children's Hospital, 14 today, 7 in the ICU. So,
Correct. Yeah.
okay, so
So I try to have the numbers as of
very good.
the day of the meeting, so we'll know what.
Very
we
good.
stand.
I appreciate that. That's very good. So, so across the board, slightly declining, except at Choney, where it's going up for children.
Right, yeah. But it looks like we're trending in the right direction, so, but, you know, as I guess you mentioned, this is not something that's gonna go away. I think most of you have learned or heard that, you know, the anticipation is that the recommendation will probably be that there'll be a yearly vaccine, similar to what we do with the flu shot, so. So this looks like it's gonna be with us for a very long time.
But the administration of Washington, I believe, has announced, or at least maybe it's rumored that they plan to announce in May the end of the emergency. Is that, do you know?
I've not heard that.
Yeah, I think there was something that came out publicly just this week that the president is planning to declare the end of the emergency in May.
So in terms of what I reported last month on the Medical Center Neighborhood Fund, the deadline has passed. We closed applications out. In the 36-year history of the fund, never have we received about more than 80. And this year we received a little bit, I think it was 82 applications from groups in the community. So that, you know, I want to thank everybody who helped get the word out, but it's a good number. We've never had that many organizations. And it also goes to show that, you know, this community is resilient, and we have organizations that are, you know, continue to be strong and you know, bring and doing the work that needs to be done for our community. So I think there's a positive sign for us that we have so many groups who are active. Just to finalize, piggyback on the last presentation on tobacco education, just want to also mention that this week we had a presentation on, it was called The Truth About Smoking, Vaping, and Hookah. And it's something that we provided to the one of the PTAs for one of the schools. We're going to expand that and offer it to all the other schools. We have about 40 parents who attended. Very, you know, good information disseminated, and you know, we want to continue to do similar presentations to as many groups as possible. We're going to be focusing a lot on the PTAs because I think it's important that they get the information and also filters down to their kids if it's, you know, something they feel that it's important and worthy. So we're going to continue those presentations throughout this year, and of course, you know, if you know of any groups that could benefit, not only on this particular subject, but any other subject, we're open to be able to bring our, you know, our staff, our clinicians, our experts to come and speak to the community. So, and I also maybe, you know, suggest that maybe this committee may want to listen to this, you know, particular subject on the truth about smoking, vaping, and hookah, and that was done by Dr. David Alpert, I think, who you know, Steve. He runs a clinic, one of the dental clinics. So very good presentation. So if this committee's interested.
So is that a video? Or?
No, it's I mean, he has some stats. It's a, you know, he does it would be a virtual presentation. Yeah. So that's really, I have for the moment. I'm not sure if I'll be able to stick around for the duration of the meeting. I do have an early morning medical appointment with my orthopedics.
Oh, God.
Yeah, so unforeseen circumstances, but
All right, let me just ask you, there was a settlement with the New York State Nurses Association, but then apparently something happened where they were conducting a sit-in at Milstein. Has the
so that
has the settlement unraveled?
no, so my understanding that is not the the nurses based on the nurses contract. This is pertains to retirees. So I gathered that there may have been some sort of provision within the contract that they may not have liked, but it centers around the retirees.
So it wasn't the actual New York State Nurses Association conducting that sit-in?
Well, I believe that the retirees are members of NICE.
Of
So
the union, yeah.
right, correct. So it does involve the union participating in whatever activities took place. But these are not current active nurses. These are pertains to nurses who have retired and no longer working at the hospital itself. They're retired.
Or so has that issue now been resolved?
I'm not quite sure whether it has,
Uh,
but I could follow up and give you specific details in terms of what were the grievances and sort of update on those discussions.
yeah, we'd appreciate it. I need to look at it myself.
Mhm.
And my last question is anything happening with the Coogan's location? Is the hospital planning to rent it to another restaurant?
So I actually, as a matter of fact, inquired not too long about it. There are the facilities team is looking at the usages at that particular space, whether bringing back a restaurant or something else in terms of usage. So they are actively looking at that space and see what could be done with it.
All right, well, it's a shame that it's been vacant for so long.
Mhm.
All right, well, thank you, Julio.
Sure, Steve.
Hey, are there any other questions for Julio? Mary?
Since you raised the issue about Coogan's, I'm just wondering what the latest is with the hotel that was going to be built.
Mhm. So right now, when the whole pandemic sort of started, everything was on hold. The whole scenery has really changed. And at this point, there is nothing really slated. There's no update that I could provide you with the new building that was scheduled to go there. Of any changes that designed to it. So there's nothing new that I can report on in terms of that space. But once decision has been made in terms of how that space will be utilized, I will certainly bring back to this committee and let you know what's going to go there.
Okay. So people keep asking me, so.
No, yeah, absolutely. I fully understand.
Julio, are you suggesting that the hospital may not build what they had previously presented, the 13-story building with all those different elements, the residences for affiliates and the so-called hotel and the daycare hub, the child care hub, whatever it's called.
Early childhood hub.
Yeah.
So right now, one of the most important components that I felt that for the community took interest of was this early childhood hub, bringing in different services to cater to the sort of 0 to 5-year-olds or 3-year-olds. That discussions with the community groups, we were working in collaboration with a number of daycare centers and childcare providers in the neighborhood. Those discussions continue. We're looking to find space that that we can move forward with that. Now, when the decision comes to build this building, where this particular piece will be back on there, I cannot say. I think they're looking at the whole, parcel to see what could go there. I'm not sure whether the hotel and housing, it's still an option, but they're looking at it, evaluating how best to use the space. And again, when that decision is made, I will be able to come back to this committee and let you know for sure what will go there. I don't want to say
Okay.
this is off the table, that is off the table, because I'm not sure.
All right, so it sounds like they're taking a new look at what could be done with that block.
Correct.
Oh, okay. All right, well, that's interesting. Okay, thank you. I don't see any questions.
And thank you, Mary, for that.
All right, very good. All right, I may lose my computer connection in a moment, and I should be able to restart. But let's move on to the report from Isabella Geriatric Center, Diane Ashley.
Hi, good evening, everyone. My report is similar to the ones you've been hearing about improvement. Very pleased to say we currently have no residents who have COVID. So we are thrilled about that. Obviously, that's a state that changes, but thrilled to report it. Our vaccination levels are holding pretty steady with what we gave you the last time. 89% of our residents have received 2 vaccinations. 48% have received the bivalent vaccine. Staff are in compliance with DOH vaccination requirements, and visitors continue to be screened. So happily, not a lot to report, and consistent with the other trends that are going on in the community.
All right, well, thank you. Are there any questions for Diane? All right, very good. Gosh, under let's move on to old business, and looks like I didn't do my job. I didn't get the latest reports from DEP and on street sidewalk cleanliness or on recycling. So I'll have to send that out to the committee members following this meeting. Is there any other old business?
Steve, we had a couple of people who said they wanted to speak at this point during
Yeah.
the old business part.
Yeah, I'm gonna
Oh, that's,
I'm gonna call upon them when we get to new business.
oh, okay, cool.
All right, this is on the 5G cell towers.
Absolutely.
Yeah.
I just want to, if I can, just say that on my way home this afternoon, all of the garbage cans on our corners were overflowing. And that's something I haven't seen in a while. So they seem to have been better at that. I hope it's not going backwards.
Well, maybe you should report that to Ebenezer, and he should contact the local sanitation superintendent.
Yeah, I will.
All right. We're on the new business.
Steve,
Sue, yes.
I have a new business item. Just,
Okay, go ahead.
sorry, I didn't mean to be pushy there. The new business item I have is, with your permission, I mean, it's something if you want to do, Steve, but I was thinking we could invite DEP to come at a meeting that you feel when it can fit into the calendar on for health and environment, because DEP has been doing a pilot program with noise cameras. that would be able to identify and issue violations to owners of loud, noisy cars. And New York City, of course, is one of those cities that is conducting a pilot study. Our community of Washington Heights and Inwood has 2 of those noise cameras that are part of the study, just so people know. And I thought it would be a good idea to have DP come and talk about, you know, this pilot study, why they're doing it, what they know so far. They're not telling us, of course, where the noise cameras are, obviously for obvious reasons, because if people know where they are, they'll avoid them. But we do have 2. And I just thought, I don't know what you think about it, Steve, but I think it would be something that, you know, I think the community would be interested in terms of these cameras, why this pilot study is being done, what they hope to do with this data once they are finished with the study. And, but they are not going to tell people where they are, but just all of the other information.
No, well, we definitely should try to get a report on this, but they must be, they must be more than just cameras, right? I mean, they're
no, they're set up in a specific location.
but
Two specific locations in our community, and basically it's a stationary. And when cars drive by, it will capture the license of the vehicle, and it will issue a citation.
right. So it's got to also have a decibel reader or whatever.
Yes, it does. Yes, that's what I mean. Yes, the noise camera has all of that equipped. But
Yeah.
what DEP would be best to talk about,
Yeah.
you know, how this is set up and everything. That's why I think it'd be a good idea to have them
But
come and
No, I
talk about that.
Yeah, definitely would like to hear about it.
Mhm. That's all I got.
Okay,
as
very
far as
good.
new business.
All right, so let me go to the members of the public who wanted to speak. And again, I may be canceled out at any moment, but I should be able to come back in a couple of minutes afterwards. So it,
Uh-oh. I guess we should just wait for Steve because I think it's just important that he should be back in a minute. I don't know. OC's not here, so I guess let's just wait for Steve, I guess. Yeah. How's everybody doing?
He will reappear like magic soon.
He will reappear like magic. Thank you. Oh my goodness. But who wanted to speak? So I know there are a couple people, maybe we can get them organized. OC is here. She just joined us. Yes. Okay.
Gary Eltham has a message in the chat that he'd like to speak.
Okay, so Gary,
Mhm.
there was another request to speak from a couple people. I thought, if you want to speak during the new business part about, and I know Odette Wilkins was one of the people. Odette, if you still want to speak about the cell towers, now is the time to raise your hand so Steve can, make that decision in terms of the order. And Gary, same, raise your hands. Anybody else that wants to say something during, yes, good. Everybody's doing that. Great. So now when Steve gets back, he's the chair, so he's going to make decisions about order and everything like that. Okay, he'll hand it up from here. Thank you, everybody. Just be patient. He'll be back with us soon. Hi, OC.
Hi.
You miss rats and weed. We had it all tonight, OC.
Where's Steve?
Oh, he just, he sometimes logs out and logs back in.
Yes. Yeah.
So you missed it all. OC. We'll have to catch you up.
Yeah. Please. I wonder about the rats. Any resolution about that?
Well, yeah, it's just a presentation about the initiatives that they have with the rat mitigation. So one targeting businesses with outdoor dining. So
Okay. Any cats
Pilot.
involved in this?
no cat, nothing.
Oh, really?
No
Interesting.
cats.
Curtis,
But again, I don't.
Curtis Lever was not part of the discussion.
No, there was there's some stuff that some companies are working on, but
Steve is back.
yes, Steve.
So Steve, they all have their hands up. So it's on. You're the chair, so you take it from there, but I just had them all raise their hands, so
Okay, thank you.
you're welcome.
Okay, so Sue Peters, I think you've just been, you can now speak?
Can you hear me?
Yes.
Oh, okay, great. I want to talk to the members to tell you about something that's coming down the road for every single community in the 5 boroughs. And the City of New York Department of Technology has made an agreement with the private telecom companies to install 4,000 jumbo antennas, 5G antennas on our streets, on our sidewalks. They will be 32 feet tall. They'll have a big pod at the top that will house 3 or more antennas from different telecoms. And they have been community boards speaking out against this to the city. And I just want to give you the highlights of where you can go to get some very good information, because last Wednesday, January 25th, Queens Community Board 1, they had 2 committees that got together and said we would like to see presentations from first the Office of Technology and the telecoms, and then from the public in terms of health issues that should be known by every citizen in the city.
All right,
And
Peters, let me interrupt you for a moment. I should have mentioned this early on. We are getting a presentation from the community at the community board on Monday evening at our Traffic and Transportation Committee meeting, which starts at 7 o'clock. So this will be a focus of that meeting next Monday.
and that's the presentation from OTI?
Yes.
Okay, before that presentation on Monday, I want to send you some information because Queens Community Board 1, they videotaped the presentation and they have it a link. And I want to send you the link because it has in it the exact time to go in and listen to an environmental health expert, a police officer whose life has been decimated, New York City police officer whose life has been decimated by cell phone towers outside his house, and a member of the New Hampshire Commission that was created by the legislature of New Hampshire to investigate 5G throughout the state of New Hampshire, and came out with strong message of the health impacts and the care that has to be taken throughout the whole state. And then I think there's someone who's going to talk right after me. Odette Wilkins also spoke then, and she's a fantastic lawyer and can tell you exactly the law. So if you give me your email in the chat, I'll send you a link to this information. You can please read it before you go to the meeting on Monday.
Okay, very good.
Thank you.
Steve, when you get it, can you send it to Debbie?
Sure, yeah.
Yeah.
I mean, this is on the agenda. This should be on the agenda.
Yeah, I know.
for meeting, right?
Yeah. I'm on that committee also.
All right, but
Yeah.
Okay. Odette Wilkins.
Yes, thank you very much for having me here. First of all, Washington Heights is my old stomping ground. I grew up at 124 Fort George Avenue, right across from George Washington High School, and I went to Mother Cabrini. So, so I was in Washington Heights for my first 20 years of my life, and so I know it very well on both sides of Broadway. And I am here to talk to you because I would like to preserve Washington Heights and the historical significance of Washington Heights. And all of that will be gone with these giant 5G cell towers. They're not kiosks. OTI is calling them kiosks, but they're not. Now, I did look in the New York City data portal to see how many locations they are planning for Washington Heights and Inwood. And I saw that recently they have 8 new they have 8 locations, but there were 3 locations that they added in December, which are not any longer on the data set. One of them is 689 Fort Washington Avenue, which is where they broke ground just a few weeks ago, where it was stopped. So I'm not really sure why they took that off the list when actually they're going ahead and installing things. But in any event, the comment period has passed for a lot of these for all of your installations, but that doesn't mean that you can't still review it. And obviously, if they're going to be giving you a presentation, that means that they're going to want some input from you.
Yeah, we were told by the chair of our board that they were going to extend the comment period for us.
Oh, that's fantastic. Well, that's absolutely fantastic news, because I have some information to tell you. One of the things that I researched was the environmental impact of these cell towers. Now, the City Environmental Quality Review Act requires an environmental assessment. And OTI did do an environmental assessment, but they based it on 5G small cells. You know, those big backpacks that they put on top of the street poles and all that? Those are small cells. That is what they conducted the environmental review on. I've reviewed every single environmental assessment document that the city has produced on this, and I did not see a single one for these giant 3-story cell towers. Now, these cell towers actually have 5 bays. So there are basically 5 different floors on which, and each floor can be dedicated to a different telecom company. And the amount of radiation coming off these is enormous. Now, Sue Peters was just talking about a police officer who had testified at Queens Community Board 1 last week because he had to evacuate his house. He had gone through invasive procedures and he had heart arrhythmias, and he only had them when he was in his house. When he went to the doctor's office and they were about to do a cardiac ablation, he didn't have any heart arrhythmia, so they couldn't do the ablation. When he then left his house, that's when his symptoms completely disappeared. Now, I just want to let you know that I went to his house 2 days ago to take the measurements. When I came out of his house, and I came back to my apartment, I was in such a state of disorientation from all the radiation that was in his house that I could barely find my apartment door. I was nauseous, I was vomiting, and it was awful. I am a very healthy person, and I was totally affected by this radiation. And he's a police lieutenant of 20 years and was a 9/11 responder who lost his partner in 9/11. And this is not the way to treat a police lieutenant. In any event.
Does he, are one of these very same 5G cell towers that they're installing around the city, does he have one of those outside his house?
The city is installing 3 types. One is the backpack type, the other one is a pole top, and the other one are these huge 5G cell towers. He has a pole top, so it's on top of a pole. But the 5G cell towers are going to have much more because they're going to have 5 bays. So I have to tell you, I'm not going to go anywhere near those things because I have to function as an attorney. I can't function if I'm disoriented. I'm sorry. And I don't think anybody else can. And by the way, this is very dangerous for children. The other thing I wanted to tell you is that so under the City Environmental Review Quality Act, and you should know this because you're the Health Committee and the Health and Environment Committee, they have not conducted an environmental review on these 5G giant cell towers. And I'd be happy to share my research with you and exactly where I found them. But they should not be deploying anything without a sufficient environmental review, plus by the FCC as well. And the state has its own environmental quality review process. And that hasn't, as far as I can see, that hasn't been complied with either.
Could you elaborate as to how dangerous it is for children, please?
Oh, it's very dangerous.
We need info. If we put things like that in the minutes and potential at some point resolution, we need information like that to back it up.
Okay, so I guess you didn't, I guess my written submission was not distributed to all of you when I sent it in December to the district manager. I submitted it particularly because they were placing, and it has all the information there, Ms. Kamenar. It has all the information. It has the scientific information. It has a lot of information. I did truncate it, but I am prepared to provide you with a much more comprehensive report, which I will distribute to your district manager. But there was a 2000 study by T-Mobile done by its parent company in Germany, conducted by German scientists, and they found high risks of testicular cancer, childhood leukemia. It was particularly dangerous for children, immunological disorders, cardiac disorders, neurological disorders. This interferes with the frequency of your own body, so it interferes with your heart. And as a result of my unfortunate exposure to some wireless radiation at a very, very low level, I ended up in the hospital with super tachycardia. So this is, and I'm a technology attorney. I've been working with technology for the past 20 years. So I know the benefits as well as the risks. And I have to tell you, this is a very risky experiment that they are engaging in. And this should be nowhere near schools, nowhere near people. 4G is sufficient. They're claiming that the telecom industry is saying there are gaps in service. They have shown no reports. CB8 on the Upper East Side asked them, where are the reports showing the gaps in service? And City Bridge and OTI could not produce the reports. They said they don't have any. So
I just want to say something so I'm clear. I'm sorry if I wasn't before.
Oh, okay.
I'm not arguing against what you're saying. All I'm saying is that we need that data to prove that it is what you're saying that it is,
Well,
not
yeah.
for us, but for the public and beyond that. So
Well, you have it. You have it. I gave it to you. I gave it to the board in December.
Steve, did you get that? Do you know what we're talking about?
I never saw anything.
Okay, could you send it to Steve and Steve will distribute to the committee?
I'd be happy to. I don't have Steve's email.
I think I just put it in the chat.
Oh, you did? Oh, okay. Then I'll check the chat afterwards. But the science is there. It is established, and it's like the tobacco industry. They want to create a lot of obfuscation when the science is already there. Insurance companies will not insure. Most insurance companies will not insure for injury, personal injury from wireless radiation, because they determine it to be a high risk category. They also, and the telecom companies in their submissions to the SEC state that they could very well get into financial trouble based on lawsuits on personal injury from wireless radiation.
Will you be able to attend the meeting on Monday night?
I will be there. I have asked to present after OTI, which is what we did at the Queens Community Board one last week, but I was denied that request, and I'm only given 2 minutes.
You're only given 2 minutes at our committee meeting on Monday?
Yes.
Gosh.
I have a lot to report on this, and it's not just health, it's definitely health, but it's also a lot of other things that have not been considered, and OTI is not providing all of the information.
All right, maybe they'll be able to give you more time on Monday, but I certainly hope that you can be at least speak for whatever amount of time they give you.
All right. I'd be happy to, but there's a lot more information here and it is very dangerous for children. Children should not be anywhere near it and it will cause permanent damage.
Could you just go back? You said that the 3 sites that that were added in December are no longer on the list.
They're no longer on the list. In my written submission, I will provide you with the link for that data set. It's in the New York City Open Data Portal for Link 5G new site permit applications. The 3 sites that were listed in December and that were included in my original submission are now in the data portal. One was on one side of St. Francis Cabrini Shrine. The other one was on the other side at 689 Fort Washington Avenue, which is where they broke ground just a couple of weeks ago, where there was a big uproar. The other one was 727 Fort Washington Avenue, which is closer to Fort Tryon Park. So it's between Fort Tryon Park and St. Francis Cabrini Shrine.
I think it technically maybe it says, I think it's alongside the Jacob Javits Playground, which is technically part of Fort Tryon Park.
You mean the playground right on the other side of Mother Cabrini?
Yes.
Okay, well, that was my playground. Okay, and then 11 Nagel Avenue.
But so are they no longer being?
Those 3 are no longer on there. I will include them in my updated submission. I will separate the 8 locations that are now on OTI's list and the 3 that were not. For some reason, 689 Fort Washington Avenue, I don't know why that was taken off the list when they were breaking ground right in front of it. So this list has been changing constantly. And I don't think it's accurate.
My understanding is that they stopped working at 689 Fort Washington in response to a request from Councilmember De La Rosa that she asked that the work not proceed, and they abided by her request. But what you're suggesting now is that maybe that site and the other 2 have now been dropped off the list completely.
Well, no, when they started construction on 689 Fort Washington Avenue, that address was already off the list.
Oh. Well,
So that should have been on the list because they were doing construction. So I'm afraid that they may already have started construction on 727 Fort Washington Avenue and 11 Nagel Avenue.
I think I would have heard of if they had been doing that. And the 8 other locations, as far as I know, have they placed the 5G cell towers on those 8 other places?
I have no idea. I just did a quick Google search on those in those areas, and I don't see anything there. But then again, those photographs may be old.
Yeah, I haven't heard of that.
Could you provide with the list of towers that are scheduled to come in our district, anywhere between 155th Street and
Yes,
219?
yes. That'll be footnote number 1 in my new submission, and I can submit that pretty quickly.
Okay.
Do me a favor, Ms. Wilkins. Could you put your email address in the chat, and I'll contact you.
Okay.
All right. Thank you.
Thank you so much.
All right. And again, I hope that I hope you will speak at Monday night's meeting.
Yes, I hope so too. I'm actually presenting on Monday night at CB9 in Manhattan. But I am going to come in. When do they do public comments in the?
Well, I mean, I assume that I haven't seen the full agenda for the meeting, but I'm assuming OTI will present first, and then they would open it up as we do to committee members and community board members, and then to the general public. So I don't think there's I couldn't tell you a fixed time.
I think
It's the second item on the agenda, Steve.
It's the second item?
Yes.
Oh, gosh. All right. So what's the first one?
well, call to order.
All right, so it's basically the first item on the agenda.
Exactly.
Okay, okay, fantastic. Well, I will definitely try to be there.
Okay, very good.
Thank you.
All right, thank you.
Thank you. Steve, do you feel that we should get any information on that problem from the health providers? Maybe the hospital is seeing some illnesses related to those towers that maybe they can report back to us?
Well, I get the sense from Ms. Wilkins that the 5G towers are, which have not yet been installed in our district, I think, are more dangerous than any that would currently exist. So
I just wonder if the health professionals can tell us more about that, if they have any information that related to that, even if it's not in our, it will be nice to hear from the professionals, the help.
well, Julio, do you think there's some information you can get for us on this matter?
You want to send me a little, shoot me an email on it, and I'll search around.
Okay, very good.
I'll figure out someone that can provide information.
Okay, well, Ms. Wilkins also says that that she might be able to that she would be able to provide a health professional who could speak on the subject.
Mm-hmm.
But yeah, I'll send you an email.
Great.
All right, very good. All right, is there any other new business?
I just want to say I'm so glad that we finally got the chat back. It's so helpful. That's all.
Steve, I think you did have one other member of the public who wanted to speak in the attendees section.
Oh, yeah, okay. All right, Dr. Altheim.
Yes. Hello, everyone. Hello to the new committee members. I'm Dr. Gary Altheim, and I wanted to announce an event that we're having on Friday, February 10th, which is about mental health and artistic healing. And it's a free event for the community where people can come virtually and bring their artistic expression. We also have created a mental health coalition, a mental health and equity coalition. We know about the importance of mental health in our community. We know that the resources are decreasing and the needs are increasing. So GDS has created a coalition alongside other agencies, and we invite the Health and Environment Committee to be part of that, and we'll be announcing that it is at other committees. The goal is to decrease the stigma of mental health and to help educate organizations, community members about the importance to advocate for mental health and access to mental health in our community. We unfortunately at GDS lost a teenager that died by suicide. Mental health is very close to my heart because as a psychologist, many of you may have known that we were based out of the New York City Fort Washington Armory, offering free mental health services for 20 years. We built out raw space there, and growth and development services in GDS is still, right now we're currently working with Youth Engaging Seniors, our program at Dyckman Senior Center. We're also helping to raise awareness about the importance of mental health in seniors. Hello, Diane. I used to work with Betty, God rest her soul, and she at Isabella. And I just wanted to raise awareness about the importance of mental health services. Some people have been asking if GDS is still doing their work. We're doing it virtually while we're still looking for a space. And we are also looking to the public officials and some community board members that have agreed to help us find space after we were wrongfully evicted from the Armory. And we're also pursuing a conflict of interest that happened on the vote related to GDS being reinstated as a stakeholder in the building. So I appreciate everyone's attention. I hope people share this event. Historically, our community board does not share GDS events, and we really would love you to share it. I sent it to Ms. Diaz, new chair, and I appreciate the ability to raise awareness about mental health and let people know what's going on with GDS. Thank you very much.
I believe the community board has sent out announcements of your events.
No, we have documentation of that, but I'm not here to argue. I'm here to advocate for mental health. So we have a lot of documentation of, and we also have the documentation of the conflict of interest of people who voted and shouldn't have for GDS.
Yeah, I'm sure you do. Okay, thank you.
There's someone named Sandy that said they had asked to speak.
Sandy Galawangi?
Yes, Steve, can you hear me?
Yes, go ahead.
Okay. I also wanted to talk about mental health resources, which seem to be the stress in the neighborhood right now is very high, also indicative of the amount of pot smoking going on among young people. But there seems to be a difficult area to get resources for marginalized youth and for seniors. I'm speaking firsthand because I have a son who is a special needs child and he has high functioning Asperger's. And when I went to the Washington Heights board, the community board for education to get him special things that he's entitled to by the education department, like reading room and other things, I was told that all of our resources, extra resources in education in the Heights goes to ESL. And I am still trying to get therapy and social work for my son, who is about to go out into the world, and I want him to be able to stand on his own feet. He's aged out of Adolescent Health Center, where I had been sending him for a while. I think it's not just my son. I think that students, young people in this neighborhood are in desperate need of mental health and life skill training. It's very hard for GDS, who I participate with, to continue giving services when we have no home. And life skills are really important in this, particularly in this neighborhood where there seems to be a shortage of training. A person who can't fill out a college application is not going to go to college. A person who can't write a resume is not going to get a job. A person with mental health issues cannot succeed. And all of these things have been supplied as free services with counseling services. And I myself worked as a mentor, teaching young people how to do certain things to prep for job interviews. And I think it's very, very important, as we are, GDS is supplying licensed psychiatrists, social workers, free of charge to the neighborhood. And all we are asking for is help to find a home in the neighborhood so we can better service a large clientele. Most of the young people are Washington Heights based. And our mission is to provide help for youth and seniors. And we want them to reach their full potential. And I think they all need assistance. And I thank you for the time allowing me to speak.
All right, well, thank you. All right. I think that brings the meeting to a close. So
wait, are we at announcements, or I thought we?
Yes, we always have announcements.
I have one.
Oh, well, I hope so, because you insisted that we have announcements. All right, OC, what's your announcement?
I'm for those who don't know, I'm doing cat rescue in Inwood for about 8 years. And so I'm announcing that February will be a month where what I call like Fix Your Bodega Cat Month. So I'm asking everyone,
Say that again.
Fix Your Bodega Cat Month.
Fix Your Bodega Cat. Okay.
Right. So I'm announcing that I'm asking everyone to help me help the cats. And if you know a bodega cat where you shop that their cat is not fixed, please let's do the, let me know. Let's start the conversation and let's help those cats.
Okay.
Thank you.
All right. Anyone else? All right. I think maybe now we're ready to adjourn at about 8:48 p.m.
Second.
Okay, well, okay, I didn't even make a motion, but okay.
I'm sorry.
You can second it anyway. I appreciate that very much. I'm not even, I think, as the chair, allowed to make a motion, but go ahead, you can second it. No harm in that. So we will adjourn, and I want to thank everyone for coming. And I think we learned quite a bit tonight on a variety of subjects. So I think it was a pretty fruitful meeting. Thank you all, and see you again next month at the same time. No, next month we're supposed to have a joint meeting with the Housing Services Committee on various sanitation issues as they relate to how apartment buildings handle their garbage and put them out for collection. I'll send you some material ahead of time so you understand what the subject matter is of the meeting.
Steve, since you're doing a joint meeting, will you be looking for Isabella and Columbia to be doing presentations as usual, or is it going to be a little different?
Good question, Diane. I think we may be dispensing with our regular agenda. I'll get back in touch with you, but I don't think we're going to be able to have the joint meeting and then separate out so that we can do our usual reports. So you may be excused next month.
Okay.
So
All right.
who's the meeting with? What committee?
Housing and Human Services.
Oh, Housing and Human Services. Okay.
You may want to come anyway.
Yeah, I may come anyway. I just wanted to know if you needed us to present because we'll pull the data.
Yeah. Well, I have to talk to the chair of the other committee to see whether or not she would want to hear those reports. They may not. I don't know. Since I don't know that we have the capability to meet jointly and then break into separate sessions. Maybe there's a way to do it.
No, I'm not, but I have to listen.
I'm sorry.
You know, I like listening to you.
Yeah, I already.
Talk like that.
Yeah.
It's like watching like Perry Mason or something.
Really?
Yeah, no, you sound
Good night, Steve.
All right, something about Perry Mason. Okay, very good.
Oh, sorry.
I like Perry Mason. That's okay. All right.
Sorry.
Take care.
Bye. Thank you.